Welcome to the deep dive. We had requests for a focused look at common conditions, so today it's ectropion.
Yep, ectropion. So basically, that's when the lower eyelid sort of turns outwards away from the eye itself.
Right. And we're working from some pretty detailed revision notes here. The aim is really to give you a clear, concise picture for, quick recall.
Exactly. High-yield stuff.
Okay, so let's break it down. That outward turning, what does it actually involve?
Well, it means the lid margin, the edge, actually inwards flips out.
Yeah.
And that leaves the conjunctiva, the sort of inner lining, exposed.
Exposed to the air and everything.
Yes, and the surface of the eyeball, too.
Yeah.
Not ideal.
And I see here there are different categories or types.
That's right, 5 main types. The most common is involutional. That's basically age-related tissue relaxation. Things just naturally loosen over time.
Okay, makes sense.
Then there's paralytic, which is linked to nerve problems, like a facial nerve palsy affecting muscles.
Ah, okay.
Cicatricial is from scarring, maybe after an injury or surgery, that pulls the eyelid outwards.
Yeah.
Mechanical is when something, like a lump or swelling, physically pushes the lid out. And finally, congenital, meaning someone's born with it, though that's rare.
So if someone has this, what would they actually feel or notice? What are the symptoms?
So the big ones are irritation, redness, maybe a gritty feeling, and sort of, paradoxically, excessive tearing or watering.
Watering, even though the eye is exposed and maybe dry.
Exactly. It's because the tears aren't draining properly through the little punta, the drainage holes, because the lid isn't positioned right.
I see.
And if it's bad, you can get exposure keratopathy that's damage to the cornea because it's too exposed.
Okay. And how would a doctor first check this out? Initial assessment.
It's mainly looking closely at the eyelid. How does it sit against the eyeball? Where are the puncta? Is the lid lax, loose? They might use fluorescein dye, just a simple stain, to check the cornea for any dryness or damage.
And what's the usual approach then?
Surgery is really the main fix for anything significant, but short term, especially if it's severe, taping the eyelid might help temporarily.
Got it. Let's talk about the causes, the etiology. You mentioned age and nerves.
Yeah, those are key. So that age-related tissue relaxation is number one. But also scarring, as we said, trauma to the eyelid, facial nerve palsy affecting muscle control, certain skin disorders that affect the eyelid skin, and those congenital abnormalities.
Are there things that make it more likely? Risk factors?
Definitely. Advanced age is the biggest factor. Having had previous eyelid surgery is another one. Any facial nerve damage, obviously.
Right.
Chronic eye inflammation or irritation, and some skin conditions can also increase the risk.
So how does this outward turning actually mess with the eye's function? The pathophysiology bit.
Okay, so the sagging or churning out disrupts the normal pathway for tears. The puncta aren't snug against the eye to collect tears. So tears spill over, causing the watering. And the exposed conjunctiva and cornea can become dry, irritated, and inflamed. It sort of disrupts the whole tear film balance.
Are there other eye conditions that might look a bit like ectropion? Things to rule out? Differential diagnoses?
Yeah, you'd want to distinguish it from entropion. That's where the eyelid turns inward.
The opposite, right.
Exactly.
Right.
Or trichiasis, where the eyelashes grow inwards and irritate the eye. Sometimes a severe paralytic ectropion needs specific consideration. Basically, other causes of eyelid malposition.
And how common is this condition? What's the epidemiology look like?
We don't have super precise UK prevalence figures, but it's definitely much more common in older people. You see it increasingly, say, over the age of 60.
Okay. So clinically, what are the key things you actually see? The presentation.
Well, the obvious sign is the lower eyelid visibly turning outwards or sagging away from the eye. You can often see the red, exposed conjunctiva.
And reminding us of the symptoms the patient reports.
Yep, that excessive tearing, dryness, redness, general irritation, maybe a gritty feeling, and sometimes sensitivity to light.
How is it formally diagnosed? Are there lots of tests, investigations?
Actually, no. Diagnosis is primarily clinical. It's based on the examination, assessing the eyelid position, checking for laxity, looking at the conjunctival exposure.
So not usually needing scans or anything like that?
Generally not, unless perhaps they suspect a specific underlying cause like a tumor causing a mechanical ectropion, but that's less common.
Okay. And management, what can actually be done?
It really depends on how severe it is and the underlying cause. For mild symptoms, just managing the dryness and irritation is key.
So like eye drops.
Exactly. Lubricating eye drops, maybe thicker ointments, especially at night. Sometimes taping the eyelid shut at night can help protect the cornea.
But for more persistent cases?
Then surgery is usually recommended. It aims to tighten the eyelid and restore its normal position against the eye.
And what's the outlook generally? The prognosis?
Oh, it's generally very good, especially with treatment.
That's good to hear.
Surgical correction is often highly successful and provides long-term relief, restoring normal function and appearance.
What about if it's left untreated? Are there potential complications?
Yes, definitely. If it's severe or goes untreated, you can get chronic eye irritation, persistent conjunctivitis, that corneal exposure we mentioned, which can lead to ulcers or scarring.
Which could affect vision.
Potentially, yes. If the cornea gets significantly damaged, it can impact vision, so it's important to manage it.
This has been really clear. Now, for revision, is there a handy way to remember the common causes, a mnemonic, perhaps?
Yes, there is. You can use old sick face.
Old sick face.
Old age, laceration or trauma, disease like skin disease, surgery previously, innervation issues, nerve palsy, congenital, and K for known previous issues.
Old sick face. That's brilliant. Very memorable. Okay, quick scenario then. A 75-year-old patient comes in, chronic tearing, their lower eyelid looks red and seems to be sagging outwards, most likely diagnosis.
That sounds very much like Ectropion.
Perfect. So, to sum up, Ectropion is that outward turning of the lower eyelid, common in older adults, often needs surgery for a long-term fix, and understanding the causes and potential problems is crucial.
Absolutely.
And if you're revising for the MSRA exam and want more resources like this, do check out passmsra.com.
And don't forget, there are also great free resources available over at freemsra.com.
Right. And one final thought to leave you with. Thinking about eyelid anatomy and how it changes with age, how might that knowledge shape future strategies for, say, preventing or intervening earlier with conditions like ectropion? Something to ponder. Thanks for tuning in.